It's not officially winter yet, but it's certainly getting colder out there. And with the change in the weather comes the pressing need to find safe shelter for Ontario's mentally ill homeless. Joining us now to share possible solutions to this problem, Steve Lurie. He's Executive Director of the Canadian Mental Health Association in Toronto, and we welcome you back to TVO. It's nice to see you again,
Great
Steve.
to be here.
I want to start by reading something that was in the Globe and Mail last month, and then we'll unpack that as we go forward. Each night, more than 17,000 Canadians sleep in homeless shelters or on the street. But for every person who's homeless in Canada, there are 23 households that are vulnerably housed and at high risk of becoming homeless. Across the country, more than 380,000 individuals and families are living in this precarious state. Our research shows that people who are vulnerably housed often face the same severe physical and mental health problems as people who are homeless. Let's go through this, and obviously I want to start with vulnerably housed. What does that exactly mean?
Well, when Dr. Huang, Stephen Huang, did his study, he looked at people who were either in shelters or who were had no place to stay, or were visiting places like Out of the Cold, who were showing up in single room occupancies, sort of the low end of the housing, rooming houses, boarding homes that are unregulated, where you might be sharing, 6 people to a room. People who are at risk of losing their housing, or if they have housing, it's really very poor quality.
So you're making the distinction, obviously, between being homeless and vulnerably housed,
right.
But vulnerably housed doesn't sound like it's that much better. Is that fair to say?
No, it's not better, and many of them, in fact, become homeless. So, they may be living in a boarding home on Queen Street now, and then, a week from now, they'll be homeless.
I have often heard it said, and I'm sure you have too, that when people are, let's say, walking in the downtown of a big city and they see somebody who's quite evidently mentally ill and homeless, they will say they prefer to live in the streets as opposed to in a shelter or in some other kind of facility. Is that true?
I don't think it is. I mean, if you look at some of the statistics here, even in the city of Toronto, the city did a streets needs assessment in 2006 and 2009, and they found in 2006 they had about 800 people who were living outdoors. And then in 2009, because they'd implemented streets to homes, that had declined by 51% to about 400 people. But they still had, close to 5,000 people in the shelter system. So people are in the shelter system not because they want to be there, but because they've got nowhere else to live.
How do you keep the people, that 400 though, that are still out there in the streets, how do you keep them safe in the wintertime?
Well, it's a challenge because some of them are living, in the Don Valley ravines, and you try and encourage them to come inside. Some of them will make use of the Out of the Cold. Ashnabi has a mobile team that talks to people on the street, and Street Health has mobile teams. You try to get people to come inside, especially when there's a cold alert.
Based on your communications with people who are supposed to know these things, do you think there will be enough spaces in shelters for the mentally ill as the winter approaches?
Well, it's always going to be quite harsh because the shelters themselves are filled to capacity, unlike Calgary, which has been able to actually close shelter beds because they've implemented more supportive housing. We actually haven't added to our supportive housing supply in many years. And then you know that at this time of year, Out of the Cold gears up. And they gear up precisely because there have to be additional spaces for people to stay in churches and synagogues because the shelter system isn't available or it isn't desirable.
Sounds like we need more shelter space, though.
I think we need more supportive housing. There's lots of evidence that if you can provide safe, affordable housing for people, they'll stay there. They won't choose a shelter, they won't choose Out of the Cold.
That's much preferable to shelters.
Absolutely.
It is, okay. The shelter system that does exist today, that network, how long do people traditionally, if you can give a ballpark on that, how long do they tend to stay in that system?
Well, I mean, some people will stay in that system for many years, and it's getting increasingly difficult. For example, there's a wait list for supportive housing. So this is for people who are living with a mental health issue and who would want to have their own place. 3 years ago, that waiting list was 700. It's now 5,000. So what that means is if you need supportive housing and you happen to be homeless, you could wait 2 to 3 years before you'd be able to get a place of your own.
Which basically means what?
Which basically means you're going to either be vulnerably housed, as we began the conversation, you know, couch surfing or living in shelters or just trying to get a room where you can, and you're going to be living in substandard housing at the very least. With
all of your stuff in a shopping cart or a bag or something like that. Another term I've heard, housing first. When people talk about that, what do they mean?
Well, the notion is that you get people safe, affordable housing, and if you do that, then you can fold in the other services that people need. And this has actually been very well researched in North America, and the Mental Health Commission, as you might be aware, has just been doing the largest study of it in the world, and have shown some really compelling results, where they've housed about 1,200 people across the country in 5 communities, including Toronto. And what they found is that 73% of the people have achieved stable housing, compared with 30% treatment as usual. So in other words, people who sort of move in and out of the shelter system, people who were living outside. So you've got almost a 2-to-1 success factor. Plus they showed for the high needs group, the people who would have been supported by a multidisciplinary team as well as having the housing, for every dollar you spend, you save $1.54.
There's an explanation for that somehow, right? You spend $1, you save $1.50 because?
Because there's reduced justice system costs, there's reduced hospital costs, there's reduced hostel costs. For example, it costs $100,000 a year to keep somebody in a hostel. The figures from the At Home Chez Soi, the Mental Health Commission project, showed that the high user group, the ACT team, the multidisciplinary team, plus the housing cost $21,000. So $21,000 compared with $100,000. So what would you rather spend it on?
Gotcha. Here's June Conway-Beebe writing in the Toronto Star. You know her.
I know her.
If only it were true that simply having a place to live could rescue all society's homeless citizens. But surely we know that untreated mental illnesses are the root cause of much of this shameful homelessness. So without timely and effective help to alleviate the symptoms of brain diseases, a quote-unquote housing-only plan will fail the most seriously mentally ill, regardless of what research reports. Supports must be brought into the homes of the mentally ill to help prevent the natural relapses that can occur periodically. We also know that without the medically recommended treatment for their serious brain diseases, their lives can quite quickly become chaotic and risky. Now, this is June, the former executive director of the Schizophrenia Society of Ontario. She wrote that in a letter to the Toronto Star yesterday. She's skeptical, apparently, of these Housing First initiatives. Is she right to be skeptical?
No, she's not correct. I mean, the evidence, it was a control study that was done by the Mental Health Commission, that it is being done. That's not to say that a proportion of people have difficulty. In fact, 15 to 20% of people who are housed even with a Housing First, and Housing First doesn't mean housing only. It means a minimum of 1 contact a week, and you work with people, and so the assertive community treatment teams or the case managers may be seeing people daily. If you are assigned to an assertive community treatment team, you actually have access to a psychiatrist. So the kinds of things that June is talking about that need to be in place, in fact, are. That's what the team does. They help monitor people, make sure that they're prescribed the right kind of medication, can get somebody into hospital if things go south. But again, in most cases, and again, this isn't just the Mental Health Commission study. Sam Sambaris has done this research in Pathways project in New York City. Basically, you succeed 85% of the time. That's a pretty good track record.
And what do you do about food, medical care, rent, all that stuff?
Well, through the Housing First model, it's based on a rent supplement, so people are given a rent supplement to enable them to pay market rent. So the difference between what they get on ODSP and market rent is covered through the rent supplement. And regrettably, there hasn't been any increase to rent supplements in this province since 2006. So there's a lot that we could do there. And then, the team moves in. People either have a case manager or a prime worker, if it's an ACT team, who help them with How are you going to arrange for food? Some people may have to initially be encouraged to go to a food bank. Some people, if they have their own apartment, are likely able to get instruction on how to prepare meals and for themselves. And that's actually, it's really helping people live a very normal life. You know, you have your own meals, you come and go as you please. In fact, the Streets to Home study that I mentioned earlier that was done in the city, and Stephen Huang's study showed that most people, about a third, complained that they didn't have enough food to eat. So if you can start with a housing first that gives people a place to live, and then you can develop the support services around them as June recommends. So you got to have a plan for how are you going to arrange for food? What are you going to do during the day? So people can be encouraged to look for work. And many people living on social assistance and living with mental illness want to work. And in fact, that's one of the things that's been demonstrated in Housing First. And I think your viewers should recognize that here in Toronto, we've got about 4,500 supportive housing units where people have been implementing the Housing First model for 20 years.
4,500, but you need how many?
Oh, we could probably use another 7,000 to 8,000 tomorrow.
That's not going to happen. Money's tight.
Well, it
so
should
what's the
happen.
plan?
Well, you know, some of this is relative cost. I mean, if you were to look at, let's say, the cost of having 10,000 people live in a hostel for a year, over 5 years, that works out to be about $5 billion. And if you take a Housing First approach and use the findings from the Commission, you could actually spend less than $3 billion successfully housing the same population.
Okay, so presumably you've made this case to governments, and you've made them, or you've tried to make them appreciate how it makes more sense to do this kind of upfront investment now. You'll have big savings down the road. What's the reaction?
Well, I think the reaction to the findings of the Mental Health Commission have been generally positive on the part of both the provincial and federal governments. I think the challenge is, you know, where do they find the money? My sense is that this is going to have to be put out in terms of a cost avoidance. Again, do you want to spend the money in hospitalization? Do you want to spend it in hostels?
It's like that old commercial, you can pay me now or pay me later.
That's right, because we're going to spend the large amount of money wrongly. So the opportunity is through looking at things like social finance strategies, as well as increasing rent supplementation funding and some modest program funding, you could actually make a difference. In fact, most people who are housed through Housing First, as I said, don't go back to hospital. They get the right treatment they need for their illness.
Gotcha. Steve Lurie, always good of you to visit us here at TVO. Thanks so much.
Happy to be here. Thanks a lot.
Support Ontario's public television. Donate at tvo.org.